And like you said, my favorite definition of philanthropy is giving of your time, talent, and treasures,
That's right.
the well-being of mankind,
Yeah.
right? To the overall well-being of the people next door, the people down the street, the people around you. And that's what we do at Advance. So being at Advance, it is a community health center, and like most community health centers, they are created with the heart of the community on its heart, right? They have it on its heart. And it's usually a cross section of the community that they serve, meaning that we tend to look like the community that we serve. So our brand at Advance is important, right? We look like the people in Southeast Raleigh.
Yeah.
We have a high minority presence in our patients and our staff. So it gives our patients the foundation to come, a safe space, right? That's a beautiful clinic, not feeling like they're there because it's the only place that they can go. We are chosen. They choose us for those reasons, right? So when they come in and you see them navigate through the healthcare system and you identify their needs, and you mentioned Pinnacle Bank at the beginning. Pinnacle Bank has been a force for us in going through with our mission. Most recently, they helped us supply our food pantry.
Oh,
And our food pantry is very simple. And I like that you made the difference kind of between philanthropy and charity. A lot of people think of it as money, but again, it's time, talent, and treasures, right? Pinnacle Bank, in partnership with Food Lion, has been gracious enough to fund the project of the food pantry, which is just a lock cabinet in pediatrics. I noticed that with my patients. When I would go in the morning, a lot of times they would be angsty. Patients that would normally give me all the time I needed to complete the visit or never rush you or anything. But if their appointment was in the morning or around lunchtime, the parents were anxious. The kids were like, we got to go, we got to go. And it wasn't until I started asking the children that I realized that they were anxious because they were going to miss breakfast at school, right?
Okay.
Because of the demographic that we serve, a lot of our patients are on the free and reduced lunch program, right? So when they are at my office at 8:15, they haven't had breakfast, right? Because that's not a meal that mom has prepared for, oftentimes, right? So in my clinic, if I'm taking a little bit longer, they miss breakfast hour at school, so they're not going to eat now until lunch, right? So it took some recognition on my part and some probing, but I finally figured out that that's what the angst was about. So I took it back to the powers that be at Advance, and I was like, we got to create some type of food shelf. We need to be able to give them something that ties them over until lunchtime. So Pinnacle and Food Lion Cares were gracious enough to fund that. And with the help of our nutrition program and our medical providers, we put together a healthy alternative to nothing that includes a lot of nutritious snacks, non-perishables that we can house in that cabinet. And when a family like that comes in, we're able to give it not only to our patient, but everybody in there, including the parent, right? So it's meeting the need, recognizing the need and meeting the need.
Yeah. And that's so powerful. And I think in our community, we have to pay attention to what's going on.
You have to.
Right, in the community, because there are needs everywhere.
Right.
Literally everywhere.
Right.
And if you open your eyes, you can contribute. There's volunteer opportunities. I mean, they can donate the money to you and you can buy the food, but you still need people to help and administer that in a certain way. Do you all accept volunteers to come and help?
We accept volunteers in many capacities. So we have volunteers just recently. We had college students, my daughter was one of them, who came in and helped us get our population registered for my chart over the summer, right? Because again, the providers, the staff, we recognized that that was a care gap, right? Parents weren't able to, like some of the bigger healthcare centers, see their results or get messages to them efficiently because they just didn't have my chart set up, right? It's not that we don't have it, we offer it too, but our patients just weren't set up for it. So some of the bigger centers would put it out there, let them scan the barcode. If they get it, they get it. But it was important for our patients to have it. So I often tell people that the providers at Advance differ and our brand at Advance Community differs because we don't just come to work from 8 to 5 or 8 to 7. We do that part. But in addition to that, philanthropy happens. That is recognizing that your children are anxious because it's after 9 o'clock and they're still at the doctor's office, right? That is recognizing that I sent you 10 messages and you haven't gotten any of them because you don't simply know how to sign up because you're not tech savvy. You don't know how to do it. So it's recognizing the need and putting something in that need, someone in that gap to fill the need. And that's what we did with volunteers this summer.
Yeah.
So that's
It's-
what makes this different.